streaming details. Oh, now I see it. Okay.
Yeah, there's a little
Okay.
down there.
Yeah, I see it now. So we'll go ahead and get started with our agenda. Um, and Brenton, if you or another staff person would just let us know once we have a quorum, so then we'll know that we can vote. At this time, we don't have a quorum, so we cannot vote or make motions.
Yes. So I will say, if you are on the committee, if you could put your camera on if you're a committee member, that way we'll know you're here. But thus far, we have you, Ms. Jill Eagley is here, Ms. Julie Hagan is here, and we have Ms. Nicole Banks as well. And that gives you 4. We need 6 to have a quorum. So if 2 others join us, I'll chime in and let you know.
Okay. So we'll start off with the first item on the agenda. We'll do welcome and introductions. So if you are a committee member, I don't know who, I guess if you have your camera on, I'll call on you. So that means that you must be a committee member. So Julie Foster Hagan.
Here.
I'm sorry.
Can you guys hear me?
Okay, I can hear you now, Julie.
Okay.
Nicole Banks.
I'm here.
Hey, Nicole.
Hi.
Jill Eagley. Looks like Jill may have walked away, but I see her camera on. Is there anyone else on the committee that's on this meeting? Brenton?
Going through the participant list now. I don't see anyone else just yet.
Okay, so we'll have we'll look at the meeting summary from January. We'll have approval of, well, we can't have the approval, so we'll just.
No, you may as well skip right into the ARC. If
Okay.
they come, if we do get a quorum, we can always circle back to the January meeting summary.
Okay, so we'll look at, the next will be the Office of Adult and Aging and Adult Services, which is through the ARC, which Kelly Monroe will provide the report on the SPAS program.
Hey guys. Okay. So so I think I'm pretty sure you all received the report. So I'll just jump right in. Can you guys hear me pretty good? Okay, thanks. I'm working from my phone, so bear with me. Okay. So so in the third quarter, we worked with approximately 48 people. Of those 48 people, 15 of them were African American, 32 were Caucasian, and 1 was Hispanic. For the of those people, 29 of them were males and 19 were females. If you turn to the next page, the majority of them were people who were being served in regions 7, 9, and 2. But we can go through each one of them if you like. Region 1, there were 6 consumers, and region 2, there were 9. Region 3, there were 4. Region 4, there were 3. Region 5, there were 5 consumers. Region 6, there were 2. Region 7, there were 10. Region 8, there were 2. Region 9, there were 7. And in region 10, there were none. And of those services, of those services, everyone received support coordination. So the full 48 people received support coordination. Of those, the 38 of them received personal care assistance. 3 of them received rental or utility assistance. 6 of them received some type of medical supplies or medical stipend. And at this time, none of them received any vehicle or home modifications. So totally expended amounts this year, this quarter was, the total was $202,662.84. And there's the breakdown on that chart right there. Let me turn the page. Hold on a second. Okay. So if you turn the page, we can look at the waiting list. This was something that that someone had asked us to do a couple of meetings ago, and to find out where people were on the waiting list and kind of chart that out. So currently there are 50 people on the waiting list. I can't remember exactly how many we had last time. I wish I would have pulled that other one. I want to say we were able to get some people off the waiting list because we were able to give them some one-time funds. So, but currently,
Kelly,
there-
just to chime in, y'all had 54 last time.
okay, thank you, Brenton. So yeah, so we're able to get 4 people off of the waiting list since last quarter, which was good. And as of like this third quarter, there are 50 people who are on the waiting list. And pretty much all regions were there's people on the waiting list except for 10 and except for 3 and 6. So I'm not really sure why. Maybe we need to like reach out to some support coordinators in those areas and let them know that, you know, that this service does exist and that can be very helpful to people who may be or employed or retired from employment. Or, you know, people who are on the waiting list waiting for a waiver of either OCDD or OAS. So if we turn to the next page, just kind of like tells you where those 50 people, like what exactly are they looking for? As usual, most of the people are looking for personal care assistance, where the average range of that payment range for that is $23,660. Totaling up to $946,000. Home modifications, there are currently 3 people looking for home modifications, and the average cost of that is $15,000, bringing that to $45,000. 2 people on the waiting list waiting for dental. That is averaged out at like $10,000. That might be a little bit high, but trying to estimate dental is really, really difficult. So we have you know, the estimated amount for that would be $20,000. And then the medical equipment and supplies, there are 7 people who are actually waiting for that, with that equaling out to be about $3,000 per person for $21,000. So the total amount, if we wanted to get rid of the waiting list today and serve everybody on the waiting list, what we would be needing would be like $1.1 million. I don't know if anybody has any questions. I know I kind of went through that a little fast, but I'd be happy to back it up if you need me to, or to go into more detail if that's needed.
Nicole Banks had their hand raised. Kelly?
Okay, Nicole?
Okay, so just from looking at all of the data that's right here, totaling it up, is it only going to be services, those amount of people? That's it?
You mean the people on the waiting list?
Yeah, like the people on the waiting list plus the people that has already received services. That's the total amount of people that has received services in regards to the $1.1 million.
No, people on the waiting list, it's estimated that if we wanted to get rid of the waiting list, we would need an additional $1.1 million.
To service those people that are just only on that waiting list, correct?
Yes, yes. Mhm.
Oof.
We would additional $1.1 million, which really isn't a whole bunch of money.
Okay, that was my question.
Okay. Anyone else?
Hey, Kelly, this is Brenton. That 1.1 million, is that total or just state general fund? I guess that's total funds.
Yes, that would be total funds. Sorry. I think last time we looked into this when it was like 1.5, I think of state general funds, I think what they told me was like 500,000, but I'm really not sure because that match amount kind of jumps up and down. So I would have to ask OAS, but that would be total funds.
Thank you.
Anybody else? Okie doke. Well, if you think of something later, feel free to send me an email. I'd be happy to answer any questions that you guys may have.
Thanks, Kelly.
You're welcome. Thank you.
So next we have on the agenda is our Office of Behavioral Health. Dr. Savicki, first report would be our children's report.
Sounds good. I'll wait, and I think Brenton will put it up on screen.
Yeah, I apologize. The internet's running a little slowly.
No worries. Great, thank you. So this is our report on use of these funds for behavioral health clients for kids. This particular tab is for kids. You'll see all the data reported from all the LGEs, both for the Consumer Care Resources Fund and also for the Flexible Family Fund. For the Flexible Family Fund portion, which is on the right-hand side, LGEs are consistently, connecting families with those slots. The LGEs are keeping their allocated slots pretty well filled, with the exception of maybe one or two at a time. Sometimes when they're trying to process paperwork and get folks from their waiting list transitioned over into the program, and there does tend to be some turnover in those slots, given that kids age out or they or move out of the region. But that program is moving along pretty well. Any questions on that side? And if not, I can move over to the Consumer Care Resources side. So for the Consumer Care Resources funding, we have a number of LGs are sort of moving along in terms of getting that funding out and connected to families. We have a couple of zeros. Those are the two in terms of amount expended. The zeros reflect two of our LGEs who allocate different funding for the same purpose, and they allocate their mental health block grant funding for similar, for use for similar purposes and needs. And so they have to allocate, based on federal regs, they have to allocate that money first. So when you see that zero, you'll also see down in the notes section that they are actually serving families with, a different source of funding for similar needs. And we'll see their spending from the allocated state general funds really at the end of the year is typically when they get to using those. And then we've got a couple other LGEs who are, a little behind on their spending for the year, and you'll see some explanations in the notes sections for some of the challenges that they're trying to work through. Some of it COVID related in terms of, getting families in and connecting them with services in general and getting documents signed, that sort of thing. And then in some cases, the percentages you see there only reflect their invoices up through February, because we request this report from them before they're able to, receive and process all their March invoices. So, it's not a full picture of everything that they've done in the first 3 quarters. I'll pause there. Any specific questions on the child report?
I have a question. Did you address? I see Northeast Delta doesn't have their information in.
Right. No, thanks, Brandy. No, sorry, I hadn't. Thanks, Brandy. I hadn't noticed that yet. Yeah, that we didn't have a report from them at the time that that I needed to submit this to the council for dissemination. We do have a report now. I'm still trying. There's one piece of data on it that I've asked a question on, but I can tell you. So I don't have full data report quite yet, but they're trying to answer my question and get that resolved. I think later today, likely. They are they look to be, on track. They made a budget change to their allocation last quarter. But at this point, they appear to be on track to spend their, newly reduced allocated amount by the end of the year. Their flexible family fund program is going along, similar to other folks. They've got their slots filled and are getting those funds connected to families.
Okay, any questions on the child and adolescent OBH report? If there are none, we can move to the adult report for OBH.
Great. And yeah, let me know if any particular questions on this one. A fairly similar picture. Again, only about half of our LGEs have allocated funds for the adult side. They are, a couple of those programs are at 100% in terms of their expenditures that they've already used that funding. Others are sort of along the way, and you'll see in those note sections the kinds of expenditures that they're using these funds. And in some cases, it is a combination of, just like on the child side, some LGs are using a combination of different funding sources to fund a similar program. So you may see a lower level of expenditure here that'll catch up by the end of the year. I think that's the case, for instance, for capital area.
Do we have any questions on this report?
I don't see any.
Okay. This is going by really fast. We caught up on a little delay we had at the beginning. Do we have a quorum yet, Brenton?
We should. I see. So far we have 5, 6. I think Carmen's on. I just don't see the video. So I just want to verify that she's here. There we go. There she is, masked up and ready to go. So you should have a quorum based on what I'm seeing here. You have exactly 6 members.
Can we go back to the beginning, to the first item, and look at get the approval for our January meeting summary?
It is up on the screen.
So everyone should have received the summary. We just need to get a motion to approve.
And technically, Bambi, you don't have to have a motion as long as nobody objects to this particular summary. You can just
Okay.
approve it by.
Do we have any objections to approving the summary for the January meeting? Okay, hearing none. It is approved. Okay, now we'll go to our last item, which is Office for Citizens with Developmental Disabilities. Tanya Murphy will review this with us.
Hey, everybody. Are you able to hear me okay?
Yes, ma'am.
All right. Well, I'll have to, first of all, excuse the any background noise you might hear, because I am on the campus of University of Louisiana Lafayette. I brought my daughter to Admitted Students Day this morning. And so, but I'm on the clock and I am giving this report. So we got the third quarter results from all the LGEs for their expenditures on the individual and family support program. It's kind of a range for the different LGEs. I would say Imperial Calcasieu is the lowest expenditure percentage with 37%. They did provide an explanation as to why. And I'm sure most of you are familiar with the hurricanes and the COVID and everything that's been going on with poor Imperial Calcasieu. And most of the people have moved out of the region or had to evacuate, but they are coming back in. And they said that they do anticipate spending all of their money, even though they've got a low percentage spent right now. And also, as a reminder, this third quarter amount does not include the third month, because we have to report a little early to be prepared for this meeting. And so this isn't a complete number for the full third quarter spending. And then I also wanted to bring to your attention, Acadiana Area Human Services District added $200,000 to their budget to be spent on IFS funds. So although their percentage is at 59%, they have, put an additional amount of money into their budget, which would bring their percentage down, but they do anticipate spending it all. Are there any questions on the individual and family support section?
I have a question in regards, so like with Imperial Calcasieu, it says due to the hurricanes, contracts for services were reduced and expenditures were low in the first 2 quarters. And I'm thinking that those contracts for services are probably like some type of day programs. And I think I brought this up before. I don't know if you have that information in regards to how much of our IFS funds are being used for like day programs. Do we have that information?
I don't have the percentage off the top of my head, but we can certainly get that information back to you to tell you exactly how much of it is. I know that we did pull that information, but I don't know it just off the top of my head.
Okay.
Miss Kathy Dwyer has her hand raised.
You can let her speak if you can. Hi, Kathy.
Hi, Bambi. Thank you for letting me ask a question. Looking at Jefferson Parish Human Services Authority, I see, is that 149,000 that was reduced from their budget initially?
So you're looking at the total at the bottom. That
Oh, I'm sorry. Yeah.
It's Florida.
Okay.
Florida Parish's Human Services District started with $1,049,049, and they took $349,128 out of their IFS budget.
Okay, then I'm sorry, I was looking at the wrong line. So I'm trying to see what percentage has Jefferson Parish used on their IFS fund so far? Is that the 52%?
That's right, 52% are.
Okay, thank you. Oh, and I would have the same question as Bambi for Jefferson Parish once you provide that information in terms of how much is spent on day habs.
Yeah, I think we had that discussion at the last meeting. We're also wondering about diapers too, I think. It was diapers and voc rehab, if I'm not mistaken.
Okay. Any other questions on IFS?
I don't see any.
Okay, I'll move on to Flexible Family Fund. Flexible Family Fund is a little more easily projected and more regularly expended on a schedule because it's a $258 stipend that's sent to families every month. So, you know, in the third quarter, we would expect 75% of the budget to be spent, and that's where we're at with 74% of the budget being spent. So Flexible Family Fund is on track to spend 100% of the money that they have, that the LGs have budgeted to the program. Any questions on Flexible Family Fund? So we can switch to the 9%, the Act 73. So this is the report where we talk about the total LGE State General Fund budget, and then the amount that's equal to 9% of the State General Fund, and then how much money the LGEs should be budgeting towards their Act 378 programs, and then how much they did budget towards it. All of the LGEs have budgeted equal to or greater than a 9% of their state general funds. And then the next column talks about the total expended, and that's where I took all the IFS expenditures and all the flexible family fund expenditures, added it together and put it on this worksheet here. And then it'll tell you the percent of the 9% that has been expended so far. So we're looking for around 75% for the third quarter, and statewide it's a 72. So we're on track. There's a couple of the LGEs that are slightly under, but everybody is on track to spend 100% of the 9% of the state general funds that the LGs are required to spend on this program, on these two programs. So do we have any questions about the Act 73 report?
Hey, Tanya, I assume this, the total budgeted by the LGE for Florida parishes, that factors in their 349,000, right, that they reduced? Okay.
Yeah. Yes, because at first I was like concerned because I was like, wait, their IFS is 700,000. But if you take what they budgeted to IFS and flexible family fund together, they're still budgeting a little bit more than the 9% that's required.
Nicole Banks has her hand raised.
Okay, so I have a question. When we're doing the total percentage of spending, do they have a certain time where they have to spend this money by, and where it goes and it's allocated to? So they're behind. Why are they behind spending?
They have until June 30th
Okay.
to spend all of the money. And so they report to us every quarter. And so the first quarter, we expect 25% or so to be spent, and then 50%. And so this is the third quarter. We're looking at around 75% would be an average. And then by June 30th, they should have the 100% spent.
Okay, so let me ask a question. If I see some of them are very below the spending where they're supposed to be, does that mean that the people are not getting the services that they need? Because I just want to know if that's what that means too. Because if the stuff is not being spent on what they needed to be spent on when they needed to be spent on, does that mean that the people that they are servicing is not getting it?
That's really an excellent question. And I think one of the reports that we look at to try to answer that is called our approved pending funding report. It's a report that shows you the services that have been asked for by people that the LGE has approved, but they didn't have the money to actually pay for it. And when I pulled that report, there was nobody on that report. There wasn't anybody that had asked for something that couldn't be paid for. And so it doesn't mean that people aren't getting the services they need. It just means that the LGEs are doing a good job of trying to make sure they don't spend all of their money at the beginning. They want to make sure that in case of emergencies, they've got some money left at the end to make sure that they can help people all the way until June 30th.
Okay, I was just wondering if they had something, just a backup, in case, you know, that happened. But as if this is all the funds that they're going to get in totality with everything, then yes, okay, they're not going to understand
Yeah.
that. Okay.
Any other questions?
Hey, Tanya, it's Brenton again. Quick question. So following up from our meeting last month, I know you said you don't have or last quarter, the percentages about what was used for Voc Rehab or any of the diapers or whatnot that we talked about. But I didn't know if the department had a chance to actually analyze any of that information to see, because part of the discussion was trying to find out if a lot of the dollars were being consumed for those services. Is there going to be something else that we need to do? Like, what are alternatives? There was some questions out there. Shouldn't we maybe look at a waiver for them as opposed to IFS dollars? So I know you don't have the numbers in front of you, but I didn't know if that analysis was able to be done, and maybe we could have a discussion about alternatives, or maybe if there was a better option out there for folks, or if that's just not ready yet. I was just curious about that.
I don't know if Tanya had to log off for a second. This is Julie. I can answer that question. So we had, after the last council meeting, we did pull all the data. We pulled a team together, an OCDD team together, to take a look at that data and kind of had some internal discussions to what you guys talked about. I was hopeful that Dr. Brandy Kelly could join us today, but she had a conflict and wasn't able to join us, because I think some of the questions were, and I think Bambi had kind of brought up, well, if we're using the funding for, you know, these state general fund dollars, if they were in waiver, then you would potentially be getting federal match. But part of the, and that is true, but that also then opens up a lot other services and other billable, you know, other things that they would potentially have access for. So the federal, I mean, the fiscal impact, for one, the fiscal impact would still be potentially greater if they moved into the waiver, even though we were able to pull down those federal funds. The other thing is with the shift to our you know, our prioritized waiver, I think there was some questions about, or there have been questions in the past about how does, you know, if someone is using IFS for day program, or if they're using IFS, you know, for personal care services, and then we go and do our screening of urgency of need, how is that factored in? That's why I wanted Brandy to come, because she can explain this a lot more eloquently than I can, because there's not an easy answer to that. It is a factor that can be considered, but we know that these funds may potentially not be there within the next year. So there is some consideration. The discussion too, though, is also if those funds, are not there. So if the person, you know, come July doesn't have access to the services that can be provided by the IFS, would that then place the person into an emergent or urgent category? And so we would really need to still consider the whole, you know, the whole person and the whole what's going on. And so we do consider that those supports might be in place, but we also consider those supports to potentially be temporary supports, because we don't know about the funding each year. And then we also then look at the individual situation for the person if they were to lose those funds, just like we look at things in the future, if there's a older caregiver or things like that. So we look at the potential, and then what would that do, you know, for that person? Would that then place them in an urgent or emergent situation? So it's still individualized, you know, when we look at that. We did see, if I'm in the analysis, and what we can do, if we didn't provide that, then we can definitely try to pull that data together and get it to the subcommittee, because I thought we had already provided that last quarter. So, but again, we can, I'll circle back with Tanya to see what we did, because we did take a look at it. The other thing we pulled is we have a report that we show We look at individuals who are receiving individual and family support and family flexible funds and also receiving waiver services. So we also have had a report that showed that we do have a number of people who receive those, who participate in IFS or FFF and also receive waiver services. So there's still a number that get both. So it doesn't exclude you from being able to get waiver services as well. And I can try to take a look. At one point we had pulled those percentages together, so we can give you that information too.
Yeah, I was trying to look at what we did last meeting. And so I know we had a breakdown basically of the IFS dollars by region. And then we went through and I was trying to see, and what I'm trying to look at now, if we had a percentage kind of statewide, but I think it was mostly broken down just by region. But that's how we had jumped on the topic of those supports, just seeing exactly how much money was spent in those particular services. So I think we had some of the idea of the percentages and the amounts. I guess for this particular meeting, we were just looking more of that discussion of are there other routes we can take as opposed to IFS dollars, be able to free up some of that money if so much money was going towards our vote programs. But that's probably what it sounds like, an ongoing analysis sort of thing.
Yeah, and that's why we focused on what the impact with the sun screening would be, because ultimately the only what you would do then would be to use it for potentially a supports waiver, opportunity. And again, there's not an easy answer as to whether we wouldn't just be able to make them a waiver offer. We would still have to go through the sun process, and we would have to consider, what if that funding were not available, what would then be the impact and would the person be? So it's not an easy kind of yes or no, and we couldn't replace it. We are very closely monitoring. We are still in a good spot right now to not have a waiting list. We are still, able to continue to fund the folks that we have that, have a sun score of 3 or 4. But we are closely watching it. We, and I know we have the NOW fund that the DD Council has advocated for, and the commissioner has agreed to keep $1 million there should we ever need to open it up for waiver opportunities for folks, so that we don't have to reestablish a waiting list. But I will share with you guys that in our most recent analysis, when we initially did projections, and in our pilot and in the information, that we gathered through our initial sun screenings, there was about 15% of the people that we screened who fell into that urgent or emergent category. That number has bumped up now to almost 30%. So almost 30% of the people that we do a sun screening on are falling into that urgent or emergent category. If we continue to trend that high, at some point we are going to get to the point where we either have to find additional funds or, through that NOW fund or whatnot, or potentially reestablish a waiting list, which we all, don't want to have to do. So we're trying to be careful to make sure that we would, be good keepers of those funds too. And so I understand that we would want to free up more IFS funds, but at the same time, we wouldn't just be able to kind of make that change where we say, well, if you're using IFS for day program, that we would shift you to a supports waiver. That wouldn't necessarily just be an even balance, I guess is what I'm saying. And I do understand what you guys are saying. We would at least have federal funds, but it still wouldn't necessarily just be like kind of more of a money follows the person, where the spend would be the same, and you would be pulling down federal dollars, because it then gives them access to other services that we would anticipate they might use as well if they're in that supports waiver. So I do want to make sure that I do want to give the committee the information though that they need So those were our internal discussions. And if there's anything more that we need to provide, or if I need to bring some other subject matter experts on the sun and how we consider it and things like that, I'm happy to do that as well. Want to be responsive to the committee. But I'm at this point, I'm not 100% clear on what that ask is from us.
I think Nicole has her hands raised.
Yeah, I have another question. Okay, so like you said, the money doesn't follow the person, it doesn't work necessarily that way, right? So if the money isn't following the person, is the person getting added into all of these datas? Like, how you guys have to have the budgeting, how many people are you servicing? You mentioned that some families are getting dual services, they're getting dual waivers, they're getting, from this, from one section or from another, right? Are these people being included in the data that we that we're asking for as far as how many people are being serviced and in that manner?
Yes, and so you can't be, just want to clarify, you can't be in two waivers at the same time. You could only be in one waiver at a time. But some people are they have a waiver, a home and community-based waiver, and they also participate in the individual and family support and or the flexible family fund program. Since those are funded all through state general funds, you can be in more than one of those programs, but you can only be in one waiver at a time.
Okay.
And yes, those individuals are all included in the report that Tanya just showed. So if it would be helpful for me to send the group a breakdown for the people that are, to be able to see how many people do we have who participate in the Flexible Family Fund and in the Individual and Family Support Program who also have a home and community-based waiver. We have that data available, and in fact, I have it in a binder here in my office behind me somewhere. So we can easily get that to you guys for review.
Okay, thank you.
So this is Bambi. I'm looking at that report that we had reviewed at the last quarterly meeting. It was, go back to the top of this. It was basically showing all the expenses. So my computer's doing wrong. The IFS request for the fiscal year. Then it has each of the human service districts, the categories and the dollar amounts spent and that type of thing. And Brenton may be able to help with this. We never really analyzed this. I mean, because like I'm looking at some of this, like just seeing, okay, how much diapers are we spending? I just did a quick calculation. What they have, adding all of them together, it's almost $800,000 in diapers or disposable undergarments and continence supplies. But the other thing that was really noticeable, I mean, we have a big difference in the amount that our LGs are spending. Some of them are over $100,000 that they're spending for that category a year, $150,000 for some. And then some are, the annual is $4,399 from $150 down to $4,400. Like, do we know the difference? Does some of these human service district have access to where they're getting people these resources without going to this IFS funding? Like, those are the type of questions that I would have, but do you know that, Julie?
I do not, but we can, and that you mentioned that specific to the adult briefs.
Yeah, so that the
Diapers.
category that's diapers, disposable undergarments, incontinence supplies. So for instance, I'm looking, just scrolling through capital area, has said they spent $153,000 for the year. And then I go to Acadiana Human Services where they say they spent $4,399. That's a difference of $150,000. Why? That seems, it's the same population.
Yeah, and I know that some of them have reported that they have been able to access some things like that through different sources and donations and things like that. But that's a good idea. I mean, even for that or others, in our analysis, I think we were looking more statewide, but we may need to also then, we have quarterly meetings with all of the developmental disability directors in OCDD. So maybe that is something that we would want to kind of take a look at, where are there big differences like that, and ask them to share, you know, if they're not having a lot of expenses there, what are ways that they are able to access other resources so that they can then share with their other LGE partners, you know, ideas that they might go explore. Is that what you're kind of getting at, Bambi?
Yeah. I mean, just to describe, I mean, it's the same population. You wouldn't expect $150,000 a year difference in, you know, disposable undergarments. So like there's something going on. And then I see like some of them have, in regards to dental, they have zero for the year. Some of them paid zero. You know, so why? Or are they getting dental from another source, or are they not approving dental services? And then some have, you know, much more, several thousand. So for instance, for dental, Acadiana Human Services has 78,000, but Metropolitan has zero. So what is the difference?
How many contracts did it say they entered into for those things? Because I know with diapers, you know, Capital Area may have had 100 and Acadiana may have only had 50. I don't know if that factors into some of it.
Yeah, so for the diapers, it was 5 for Acadiana, and Capital Area was 288.
So I guess, maybe Acadiana area has a untapped supply somewhere that we don't know.
Right.
Someone they can work with, so they're not getting as much request, I guess, as Capital Area maybe.
Right. So those are the type of things that I would just want to know. I mean, you would expect that the need would be relatively similar. So
Also, where are you guys getting this report from?
We have a database in OCDD called the Participant Services Database, and they enter all of the information in there. And then each quarter we pull out reports. In that database, they enter information about all of the all of the people with OCDD statements of approval in their region. It's just sort of where we capture all that information. And this is one of the they place information in there, and this is one of the reports that we pull. They send to us and they check it to make sure that all the data is accurate, and then they get it into Tanya to be able to report it. So the OCDD Participant Services it tracks lots of different things, and this is one of the things that it tracks.
Okay, well, in regards to the stuff that we're looking at right now, these reports, this stuff, how do we get a copy of this to look at? That everybody is looking at right now.
I have it.
It's on it. Oh, go ahead, Brent.
Sorry, I was going to say, I have it pulled up on the screen currently, I think. I guess you guys.
Yeah, where did you get that from? Maybe I'm having a hard time finding it because I don't know where to have that at.
I put the link in the chat. So this actual report, we get this at the end of every year. And so usually at our October meeting, this is information that we put together. It lists all the IFS requests for the year, broken down by priority. And then in the past couple years, we've gotten into more detail, which you see in this page here, that breaks it down by each particular district or authority, and kind of gives you an idea of sort of what they spent in each particular area, which is kind of in this left column here. And then it gives you at the end of the fiscal year kind of a total of everything. And so that was something we usually do in October. We moved it up, or we did not do it in the October meeting because it is a lot of data. And so we moved it to the January meeting, and we spent probably half the meeting talking about this report. And so,
yeah, I'm sorry.
no,
That's the meeting I missed.
No, so it just happened to come up again. So that's where it was at, is at the previous meeting, but some of
Okay.
the topics were of continued discussion into this meeting. We had used this report to kind of look at the vocational rehabilitation or the employment supports, which is this section down here. I'm not sure how much y'all can see, but looking at that information and then also looking at the diapers, the undergarments and continence supplies, that's what kind of sparked discussion at the last meeting to ask the department just to see, is it kind of, as Julie said, it's not as easy as just giving them a waiver and replacing IFS funds. So that's kind of what sparked it, and then just conversation developed. So that report was not included in your packet, but so you're not missing anything. It's just
Gotcha. Okay, so now I can look at it and see, because I'm doing like Miss Bambi's doing. I'm looking at the different causes. I was looking at the same thing, big indiscrepancies with across some of those numbers, and it's big indiscrepancies. That's like, okay, what's going on here, y'all? Like, are we missing something? Are y'all not sharing information? Do y'all got some coupons or something that y'all not telling people about? And that's just that's how I'm looking at it. So
yeah. So, but if you check in the chat, they'll have the link there that'll take you directly to this report. But you can also go back to any of our meetings pages and see our Act 378 agendas, and there'll be reports in there. If there's anything maybe you missed from the last meeting. I think this report is probably the only thing that was different than the typical reports that you saw this week or this month.
okay, thank you.
So if and I think Tanya, you found a charger, Tanya? You're on mute, Tanya.
I made it to my car so I could plug my phone in.
Okay, so I think based on the conversation here, you tell me, you tell the group too if you have other thoughts. I don't know whether we shared this level of detail with all the DD directors, and to my knowledge, we haven't kind of had that in-depth conversation with them. So I'm thinking that we could, at the next developmental disability director meeting, share this, kind of go through each of these major sections with them for like, hey, it looks like you guys are not spending a lot here. Do you have other resources, or to be able to then share where people may be able to go outside of that as a way, or maybe somebody says, hey, we're not approving dental because we didn't think, we hadn't really got, whether they haven't got requests or they haven't thought about it. And do we maybe even need to do outreach to educate families that this is here? Because it sounds like you said earlier that we didn't have any requests that were not funded. And so are we at a point where we can sort of do a little more outreach in certain areas where we know there's a potential gap or a need, to make sure families are aware that that's available through the program? And I think if we could have that discussion by looking at this report and sharing with the DD directors, we might be able to come up with some strategies that they might be able to not know about, that they might be able to tap into, and or some further discussion about how we drill down to helping people know this is out there. But do you think that would be beneficial?
Absolutely, because I know that when I spoke with Troy Abshire at Acadiana, they do have a special program around their dental services. And that's one of the reasons why Acadiana has such a high expenditure in dental, because they've got like a program. And, but as far as the adult diapers and stuff, I don't have an explanation as to why one region would spend so much more than another. And it might have something to do with a priority that they might place on it. It depends on the family's particular situation, whether it would be ranked a priority 1 or a priority 4, or anywhere in between, which would have an effect on whether it got funded or not. But the fact that we don't have any approved pending funding, I think is something we need to look at. And so are they just not asking for those things in those different regions, or do they have special programs there? Certainly would be helpful to us to know and to report to the DD Council, but also to all the LGEs to work together to see, what's working in your region and how can we implement that in ours.
I agree. I think that It's not really to micromanage because I know that they all are doing the best job that they can, and I know we get really great services from our human service districts. But I think there's some information that we can get from those discussions that could help make what we do more efficient and effective across the state. So, do we need are we just gonna? I guess OCDD, you guys are just committing to do a more in-depth analysis of these individual kind of like line items across the human service districts, and it'll give us an update at the next meeting.
Yeah, I think in order for us, we sort of did ours at the state level review, and in order to do the deeper dive, I think we need to have input from all the LGEs who would know more specifically. Like Tanya said, they might tell us about one-offs, like, oh, they have a dental program, but to get into the level of detail that you guys are asking, I think we would need to be able to get input from all of the LGEDD directors. And yes, at our next meeting, I mean, if you guys want to make a motion and approve, you can, but we will commit to doing that at our next DD director meeting, and then reporting back.
Okay, thank you. Now, I'm lost where we're at on the agenda. Have we gone over all the items for OCDD's reports?
Yes,
Yes.
we have. I was just going to share this particular report. I think it's on the screen currently. We haven't, you won't necessarily see this report in previous years, because I think last year, and Tanya, I may butcher the explanation because my memory is not great, but there was some discrepancies in how the LGEs documented within this system. And so this was kind of our first report where Tanya really got everyone to kind of understand why this system is so important and why keeping information updated in the system is so important. So I would anticipate probably what we'll get next fall is probably going to be even more accurate than this, because I'm hoping they would have the kinks worked out by then. But the way this report looks, it's a lot more comprehensive than what we've had in previous years. We used to just have what was on the very top here, which just gave you information about the priorities. But now that the LGEs have gotten really good about actually documenting everything quite specific and not using such random categories in their documentation in that system, we've been able to get a more comprehensive report, which is what you're looking at today.
Yeah, we added more categories so that not so many were put in just other, and then we offered a training to so that they understood how to put it into the system and what that information was used for.
All right, so I think that covers everything on your agenda as of now.
Okay, do we have any announcements?
This is Julie. Just, I think we shared the information to all the DD Council, but just put a plug in. We are having a panel discussion on April 23rd at 1:30 with a targeted, it's a discussion. So the Louisiana Department of Health has put together several, there you go, conversations on, they call it vaccine conversations. We know that there's still a lot of people who are really hesitant to take the COVID-19 vaccine, and the department and the others feel it's really very important that we do consider vaccination in order to help us. I don't know that any of us think we'll return to the same as we were before COVID, because COVID has taught us a lot of things. But vaccination, once we have enough folks vaccinated, it really will allow us to start moving in the right direction. But we know that there's still a lot of people who are either hesitant or unwilling to take the vaccine. So we put together different panels that we just say that they're conversations. Some of the surveys that the Office of Public Health did said, people don't really necessarily trust entertainers or, movie people or things like that. They trust hearing information from people who look like them, sound like them, or in the same situation as they are. So we've put together different panels. There was a panel with a target audience of a conversation with the African American community. There's one also on this day for the Hispanic and Latino communities. We've had conversations centered with the faith-based communities. And so we're happy to announce that we are having a conversation that's focused on the disability community. So it's focused on both persons with disabilities as well as their providers and caregivers and whatnot. So we've got a panel as up here, and that will be April 23rd. We already have over 250 people registered, and we've only been announcing it for a few days now. So we're really excited. There's more people registered for this panel only after 2 or 3 days of publication than any of the other conversations that we've had so far. So the disability community is really, showing up even just for the registration. Folks in Office of Public Health say that, it's a recognition of how important it is that we have this conversation, just knowing how many people have already registered for it. So just encourage folks to join us and for this very important conversation and to hear from folks. The provider groups that are on, they do provide Office of Aging supports. They are provider groups from an adult day healthcare center, but they're providers for folks just like some of our intellectual and developmental disability. And their story is just so powerful. They have, I think 98% of the staff who work at that facility have gotten vaccinated. And it's because of the gentleman you see in the middle who's just was a great supervisor and really encouraged and helped answer questions for his staff and whatnot. So we're also looking at following up potentially with one that's just focused on our provider agencies. Because what we hear from families is that in order for me to have somebody come into my home, it's important to me that they're vaccinated, to make me have any kind of sense of safety about them coming in. So we really want to, focus on the folks that are caretakers or provider staff as well. So just encourage folks to come and help us spread the word to others who may have, questions or want more information about the COVID-19 vaccination. Thanks.
And I put in the chat a link that actually Lillian is updating this Google link with tracking of disability related legislation. And so, and she's keeping up with that regularly. So anybody can go in and look and see what, based on category, the bill number, description, also what stakeholders are in support or oppose certain types of legislation. And then there's another column that says when it's going to be heard in committees. So, you could look at this or send information to, you can email myself or Lillian, which is both our first name last name at la.gov. And we'll get, just trying to keep people more informed because it's really difficult to keep track of our legislation during the sessions. It's really fast paced. Do we have any other announcements? Other than, I'm sorry.
Oh, I was just going to say, you could also go to the council's website, and our banner on that first page will show you information that we're tracking throughout session. Well, it's not moving as quickly, but that's usually updated every Friday.
This isn't an announcement, but Tanya Corman and I will definitely endorse for your daughter to go to UL Lafayette.
That's awesome. Probably showing you right now, Brooke.
I'm sorry, say that again.
I said, I don't know if the camera is showing Brooke, but we're excited about her going.
Y'all be careful. Thank you, everyone. We have the full DD Council meeting tomorrow, starting at what time, staff?
8:30.
8:30. That is so early, but I will be on. 8:30 all day. It'll be full of, a lot of good work that we've been doing. So see you all tomorrow.
Can you be my hands and get